The collective efforts of the public over the past 5 months brought the incidence of Covid-19 in Ireland down to among the lowest in Europe. But now the experts are worried that we could go backwards. The 5-day moving average of the number of confirmed cases provides the first clue about why they are concerned. At the peak here in mid-April, we were getting around 559 new Covid-19 cases per day. By the end of May, it was down to 60 per day. 3 weeks ago, it was as low as 9 per day, but now the 5-day average has gone back up to 22 cases per day. In fact, in the 7 days up to yesterday, the official figures recorded a total of 145 new confirmed cases of the disease in Ireland, an increase of 58% compared with the previous 7 days. And the cases are getting younger. The median age of all confirmed cases since the start of the pandemic is 48 years old. The median age over the past fortnight, however, was just 31 years old, reflecting the fact that younger people are moving about and socialising more and more. The number of clusters of infection has been increasing too. We've had an extra 300 clusters since the start of this month, nearly all in private households. Some of the clusters in recent days involved between 40 and 50 people in a single outbreak, and with 20 to 30 close contacts for some of those infected. However, it's important to keep it all in context. This graph shows the number of cases per day according to the date of infection going back to February. And you can see the peak of between 400 and 600 cases per day that lasted for about 2 months. We are a long way from there right now. And by comparison, the number of cases we have right now is very small. The big worry, however, is the reproduction rate of the virus, which has risen to between 1.2 and 1.8. That is how many people each infected person is likely to pass the disease on to. If it is 1.2, it means that there will be a 20% increase in the number of people in every round of infection. So if the first round of infection involved 10 people, the 10th round would infect 51 new people. If the reproduction rate is 1.5, then by the 10th round of infection, 384 people will be newly infected. If the reproduction rate, however, is 1.8, then the 10th round of infection would infect 1,983 people. So there is a huge difference between a reproduction rate of 1.2 and 1.8. And that is why the National Public Health Emergency Team is so worried right now, and why they will be watching so carefully over the coming 3 weeks before deciding if the pubs can reopen.